Yeah, that's right, Kim. You know, these hospital leaders say what this emergency declaration will allow them to do is bring in some retired folks, retired doctors, retired paramedics, retired nursing staff, and help shore up the staffing shortage that a lot of these hospitals currently face. For example, KU Hospital today saying 950 employees called out sick, so not available to work because of COVID-19. It also would allow them some flexibility in assigning the remaining staff different tasks to do. They may not be trained, or it may not be their specialty to do something that is needed, but they could be pressed into service on this emergency basis. So that's how these hospitals are trying to make it through a difficult time.
And John, of course, no one has a crystal ball, but is there any sense from them when they think this current COVID surge is expected to peak?
Yeah, we did hear from the chief medical officer of HCA Midwest. That's a big healthcare corporation that operates in the metro area. And HCA does do some forecasting, make some predictions. And according to the chief medical officer, they anticipate that the number of COVID patients needing medical care is going to double by February. So it's an already strained system that they anticipate could get a lot worse.
So could we see mask mandates returning to Kansas?
Well, it doesn't appear that that's likely. You know, the Speaker of the House, Ron Reichman, who's from Olathe, saying that the legislature, lawmakers are approving the emergency declaration just to limit the regulatory burden on the healthcare system. They don't want to see businesses shut down. They don't want to see any new government mandates. But this morning, doctors warned that, you know, with or without a mandate, businesses, the economy is going to shut down if people don't return to mask wearing. And we're already seeing some symptoms of that, with schools shutting down for a lack of teachers, airlines canceling thousands of flights, and of course the hospitals facing their staff shortages. These doctors warning that those things are going to ripple through other aspects of our economy, particularly the service sector, the hospitality industry, as businesses struggle to find workers who can work because the COVID, the Omicron variant in particular, is spreading so rapidly through our communities, making people sick and unable to work.
And John, I know we were saying that these medical professionals are very grateful that the governor made this declaration. Any sense like what that would allow hospitals to do that they couldn't currently?
Well, we talked about being able to admit more patients, more than hospitals are currently licensed to admit. This also opens the door for federal aid. In particular, Pat, the idea, we've seen it in other states, of the National Guard and military healthcare workers coming in to help relieve the burden on overwhelmed healthcare workers. And I asked the doctors this morning how close we are to seeing that happen, and they said we're very close. They may need that federal assistant, those federal assistants, the National Guard doctors and nurses, to come in to help them if the patient load continues to skyrocket.
All right, some sobering information for sure. Thank you, John.